Sectors that have all of a sudden never had this revenue the way that they did get it for the last 4 years. Yes, they had revenue, but it was a 4-year spike, a mandatory false 4-year spike, but now they want to keep it because on paper, if they lose that,
yeah, it looks like they
right,
had major losses
so
at
in order to keep it,
or whatever.
They're jumping on the bandwagon to saying, yeah, Medicare for all, let's actually don't put it in the government way. We'll just jump and merge in line from going to private. We'll still run under the guise of private names, but under these government rules and regulations for like, this is the framework. The framework's going to be the socialist, general.
Like Medi-Cal type healthcare or Covered California is paid for by the counties. So it's like a county ran thing. And they kind of pool off each other as far as the state goes. And I hear that there's like kind of almost a battle between the two, and they don't really like each other because they both have alternate agendas. The federal government would prefer to have it in the hands of a county because it's more accountable that way, paperwork-wise, and private industry would like it to be in the hands of the private industry, like Kaiser and
I'm starting to really
Blue
beg
Cross
that
or whatever
question,
the other
though.
big companies are.
Yeah, but I'm really starting to beg that as a question. Like, these private sectors are almost they've jumped on the bandwagon to going, you know what, you're right. Like, it's almost like they got the taste of Obama's Care 2014. So if you think about it, we've had since 2014 to 2019 of mandatory health care.
You're going to be speaking in general terms about like the California system, right?
Sure. So
maybe
we'll
Wyoming's different.
No, I don't think so, but we'll put it down in California, and if you find that this is relatable to other states, then, right on.
Okay.
But from my own experience in California and the private sector here is, I think...
Kelty's disclaimer.
This is Kelty's disclaimer. That there was a mandate from 2014 to 2018. So that is 4 years of mandatory income for private sectors. I mean, yeah, at the private level, they had those that were buying it because they either wanted it or thought they needed it or whatever, and then there was the group of people who just didn't have it. Well, when that 4-year period happened, it was mandatory for all, or you paid a fine to the feds. So, I mean, that was kind of like a
small fine, though, at first.
It was around a couple $100 if you were under a certain tax bracket, or if you hit a tax bracket, it was a certain percentage of your income. It would be your fine. So, I mean, there was some kind of dividend payout regardless that the government was going to be getting for not taking on the mandatory health care.
So if you had to guess about where healthcare is going to go in California.
But that's the thing is I'm getting at is like the private sector maybe 4 years ago would have said, no, let's keep it private. But now they see the money. They see that their revenues for the last 4 years have jumped skyrocket.
Whose revenues? The county?
The insurance companies, the private sector of the insurance companies. So I don't care if you're talking about Anthem, Kaiser, HealthNet, Blue Cross, whatever. It's their private sectors that have all of a sudden never had this revenue the way that they did get it for the last 4 years. Yes, they had revenue, but it was a 4-year spike, a mandatory false 4-year spike, but now they want to keep it. Because on paper, if they lose that...
Yeah, it looks like they
right.
had major losses
so
at
in order
Kaiser
to keep it,
or whatever.
They're jumping on the bandwagon to saying, yeah, Medicare for all. Let's actually don't put it in the government way. We'll just jump and merge in line from going to private. We'll still run under the guise of private names, but under these government rules and regulations for like, this is the framework. The framework's going to be the socialist, general health care for all under the guise of private, under the encouragement that it's going to be mandatory so the private sector can keep the revenues and the private tax dollars too, because you figure this all gets taxed differently than if it was a federal program versus a private program. And the states are going to not benefit or benefit depending on how that private sector is absorbing the taxes. So I don't know. There's a lot going on in California.